Hello, and welcome to your first narrated video presentation for the Community Health Worker Core Competencies curriculum. We're going to start at probably the most logical place to start, which is looking at who is a community health worker. Not only is it you who's come to participate in this training, but it's a history of healthcare workers, social service advocates, and people just in their communities building community resiliency. What we're really looking to accomplish here through this training is being able to help you establish the skills and capabilities and competencies that make community health workers a driving force in improving the conditions of the communities that we serve. So let's go ahead and get started. Here you'll find the definition of a community health worker as outlined by the American Public Health Association. It reads, community health workers, or CHWs as you'll hear them often called, are frontline public health workers who have a close understanding of the community they serve. This trusting relationship enables them to serve as a liaison, link, or intermediary between health and social services and the community itself to facilitate access to services and improve the quality and cultural competence of service delivery. Also, community health workers build individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. Now, expanding on this, with this definition in mind, can you think of some jobs that you are aware of that could fit into this category? Can you add or subtract to this list within this definition? Is there anything that you would do to maybe make it a little bit simpler to help people better understand what community health workers are all about? These are the questions that you should start asking yourself right now, right off the bat. We have these main definitions of it, but what you're going to be able to do most effectively is draw on your own strengths and draw on the strengths of the organization that you work for and really look at ways of communicating the good you're trying to do out there in the community. It's extremely important. Listed here are the 9 CHW core competencies as outlined by the Rhode Island Certification Board's Certified Community Health Worker Certificate, the very certificate you are in this training to achieve. So if you look at these 9 core competencies, engagement methods and strategies, individual and community assessment, culturally and linguistically appropriate responsiveness, promoting health and well-being, care coordination and system navigation, public health concepts and approaches, advocacy and community capacity building, safety and self-care, and ethical responsibilities and professional skills, you'll see that they bear a striking resemblance to the names of the modules for this training. That's for good reason. We want you to be trained up on exactly what unites community health workers in these competencies. So not only do you feel secure in the skills that you have, but employers will also be able to see that you all have the same abilities and capabilities. When they're looking to build teams, they're going to have a really great influence on the community that they serve. So let's now look at the many names that community health workers are called in their roles and positions across many different employers, from social service organizations to federally qualified health centers or community health centers, community action programs, many different places that community health workers reside. So we're looking at community health advisor, community outreach worker, community health advocate or representative, outreach worker, community health representative, promotora, promotores de salud, patient navigator, navigator promotores, peer counselor, lay health advisor, peer leader. And guess what? There's more. Patient health navigator, patient educator, maternal child health worker, and so on. So as you read through these and look at the rest of these, what is your title in your organization if you're currently working? What is that? Do you think it accurately represents, your position? Do you think it could be improved? Do you think that perhaps what you do could be better described by another name for it? But really think about, what are some good reasons for having so many different names for what essentially could result in many of the same actual actions and actual services to the community, many of the same skills. One of the really good reasons to have so many different names is because of that ability to better describe maybe some of the more specialized or specific tasks that you have. By better being able to communicate that, you can better help other people understand what it is you actually do, thereby hopefully getting them more comfortable to refer to you or to connect you to people that could really use your assistance. Now, what are maybe some drawbacks of having so many different names? Some drawbacks could be that when there's new positions created that have new names that perhaps a provider or perhaps a advocacy group isn't familiar with, they may actually be less likely to refer to you because they don't exactly know if you have the same skills as that position they were comfortable and understood that they referred to before. So it's really important that we're thinking about these things. And this is an important time for community health work as we're continuing to shape the way this whole format is put out there and is communicated. So you're at a really exciting time to be helping to answer some of these questions and really think about what is the best way to put community health workers out in the community and help people understand what good it is they're here to do. So we've now touched on the capacity for community health workers doing good in the community. So what is it that they actually do that's good in the community in service of the people that they're there to help? So community health workers conduct outreach, community education. They provide that liaison link that was right there in that definition, case management and care coordination, home-based support, health promotion and health coaching, informal counseling, social support, and advocacy. So these are important things. And there's certainly more that a community health worker can do. But it's also really important to ask the question, what don't community health workers do? Because you need to know where some of your limits and barriers are and when to refer to someone who has a better specialty or perhaps just more understanding of that particular topic or issue. So some things that community health workers don't do are administer medications, make diagnoses, or provide services after their shift ends. So these are important things to think about, and we will go into a lot more detail further on in the training about setting those barriers and everything. It's just good to start thinking about that now. All right, so now that we've gone over the official definition, looked at some of the different ways we name the role of community health worker in different organizations, and also taken a look and thought critically about what our place and role is within our own organization as it compares to the greater ideas of community health work. So really, what do you think about all this? I want you to think about it in preparation for our Zoom session that's coming up, because we're going to be discussing this all together as a group and building a little bit more understanding and community ourselves around these concepts. Believe me, there's a lot of time in this training to answer a lot of questions, to ask a lot of questions, to get to know each other, and all that good stuff. I'm looking forward to it. I hope you are too. Take care. Talk to you soon.